an ambulance. And so, you know, even something as simple as a broken toe, we're looking at an expense of probably $1,500.
Yeah, easily.
So it's important to have insurance.
So anyways, the first tier is the district court, which we've been hearing from,
Right.
and
the U.S. Court of Appeals.
The second level is the Court of Appeals, and then the top rung of the ladder is the
Supreme Court.
Supreme
right.
Court. Steve, you have a law degree.
I do.
Yeah. Do you think there's
from a little law school called the University of Minnesota? Actually, just celebrated my 30th anniversary since I earned my law degree. It was 30 years ago, and it's hard to believe it's been that long.
So you were only 7 years old when you received your degree?
It
was in all the newspapers.
Yeah.
Do you think there's a basis for any lawsuit? I mean, reasonable people can have reasonable differences of opinion, as you say. Do you think there's a strong case, or is?
Oh, my personal opinion, and having looked at this, I think Congress has very broad authority under a provision of the U.S. Constitution. It's known as the Commerce Clause, that basically says Congress has this authority to regulate interstate commerce. Well, there's no question, I think, in most people's minds, I think it's quite plain, that much of healthcare involves interstate commerce transactions. You may live in Minnesota, but the healthcare provider may be based in Wisconsin, and the insurance company may be based in Iowa or Connecticut or California. And so this essential nexus of having an interstate connection, interstate commerce, is there. And I think, too, that there's a real important fact to be noted here, that the elected representatives of the American people, the Congress in 2010 passed this as an act of Congress, and it was signed into law by the President. And I think that it's sometimes the case that courts will decide not to get involved in reviewing the constitutionality of a law by saying that it's essentially a political question. In other words, if you don't like what Congress did, the remedy isn't in the courts. The remedy is at the ballot box. Elect people who would do something differently. I think that this law is one of the most important things that the Congress has done, that the President and the congressional leadership who passed it deserve a lot of praise. It's far from perfect. I would have written it differently. I would have included a public option in there among the insurance options, but they didn't do that. But the fact is, this law is going to cover 31 to 32 million Americans who don't have a dime of health insurance today. It's going to expand Medicaid eligibility to families living at 133% of the poverty rate or more. That's a significant step in the direction. It doesn't get us to universal coverage, but it gets us a long way down the road toward covering people, and we should do that.
Yeah. I might mention when the Social Security Act was passed in 1935, there were lawsuits questioning the constitutionality.
And when Medicaid was passed in 1965, there were challenges. So it's not unusual for major federal laws to be challenged.
So, and that's why we have courts. But,
that's right.
But we don't look for a court decision in a matter of days or weeks or maybe months, but it could be a couple, 3 years too.
What will be interesting is if they take it on in the fall term this year, you could see a decision that could come out in the summer of 2012
in the middle
or in the fall of 2012, right on the eve of the presidential election.
Or they may wish to wait with their decision.
Yep.
Okay, to wrap up this portion on health care, if right-wing extremists, many of whom are running for the Republican Party endorsement for president, have their way, the Affordable Health Care Act would just be repealed. What would, very quickly, what would Americans lose?
A lot. Seniors specifically, let's start with seniors because that's who much of our audience is today. You would lose that closure of the donut hole on the Part D prescription drug benefit. You would lose that $250 payment that seniors are going to get who bump into the donut hole this year. Insurance companies would be able to go back to the old days when they could drop anybody for a pre-existing medical condition, including children. You would lose all of that. You would lose the creation of the state-based insurance exchanges. You would lose the regulatory reforms on the health insurance industry that would stop them from some of the really unethical practices that have denied coverage to millions of people in our country. And it would be, I think it would be a terrible step backwards for our country. The number of uninsured Americans would go in the wrong direction. It would go back up. Remember, before this law was passed in 2010, the estimates are that we had 45 to 47 million Americans with no health insurance.
Yeah.
And this doesn't eliminate that. This new law doesn't eliminate all of that, but it takes care of about 31 to 32 million people who would be able to get coverage. And let's remember this too, basic economics. The more people that are uninsured, that drives up the cost of health care for all of us, for all of the rest of us who see higher premiums, for health care providers who write it off as uncompensated care. My wife works in the healthcare field and is the administrator for a group practice of neurosurgeons. They're writing off millions of dollars a year because they don't say, we're not going to treat you because you don't have insurance, we're going to write it off. But when they write it off, what happens is the rest of us who have insurance see our premiums going up and up.
Okay, let's move on to a different topic. I promised we get to 3 today, so we have to get to number 2. Let's turn to the proposed Republican Party budget, which politicians and journalists frequently refer to as the Ryan budget, because the chief author of the bill was a member of Congress from the state of Wisconsin, Paul Ryan. But it's really the Republican Party budget. So, what extreme major change would be in store for seniors under Medicare or Medicaid?
I think we have to set the stage for why Congress did what they did with Ryan. I'll talk about a couple of the highlights of what they did. But as you mentioned, Chairman Paul Ryan is chairman of the House Budget Committee. He's from Wisconsin. And what they did was propose a budget that cuts $4.5 trillion in federal spending over the next 10 years. But it really is deeply flawed. It's unbalanced, it's unfair, and it imposes most of the burden for deficit reduction on some of the most vulnerable people in our society. It doesn't ask everybody to share equally. And you know, it's kind of interesting because I've been noting throughout the year how the federal budget debate in Washington, many of the arguments track very closely with a similar debate that we see unfolding here in the state of Minnesota at the state level. But basically, the Ryan budget would cut $2.17 trillion over 10 years from Medicaid, Medicare, and related health care programs. $771 billion of that comes directly out of Medicaid, which is for low-income families and including children too. They basically would achieve $1.4 trillion in savings over 10 years by repealing a lot of the key parts of the Affordable Care Act that we talked about earlier. And so rather than passing a budget that says, you know, we have to share this sacrifice to reduce the federal budget deficit over the long term and get us back on a more sustainable path, they don't apply it to everyone. In fact, they call for making the tax cuts, the 2001 and 2003 tax cuts, for the highest income households, they call for making that permanent in the Ryan budget plan. And if we do that, the net result is that families making over $1 million a year are going to have an average tax cut of $125,000 a year.
Wow.
And this, you know, it just is so disproportionate and so unfair when you look at the sacrifices that we're calling on seniors and low and moderate income families to make. This is what's got people so upset. The other thing, it would change Medicare as we know it into a voucher plan that basically a set amount of money would be established and you would be asked to go and find private insurance to take care of your health care needs. We would not have Medicare as we know it. Medicaid would be changed into a block grant program. And the way that works is this. Right now, federal law sets the eligibility standards for Medicaid. If you meet those eligibility standards, the federal government plus the state of Minnesota combine pay for the health care for low-income families, including a lot of families with kids. Well, under the block grant proposal, all of the 50 states would get a set amount of money based on some yet-to-be-determined formula, regardless of how many people qualify for Medicaid. So basically, it would, in my mind, it would be ending Medicaid as we know it. And it's definitely not the right way for us to be going.
So this essentially privatizes Medicare the same way that President George W. Bush attempted to privatize
Social Security
a few years ago. This budget has been adopted by Congress. It did
well,
not,
by
it,
the
it,
House.
By the House. It did not get to the
Right.
Senate or to the President. Okay, we just have about 2 or 3 minutes left. Let's move to the third subject area, Social Security.
Yep.
At one time, there was a gang of 6.
Now it's a gang of 5.
Which is now a gang of 5 senators. What kind of recommendations are they considering, or even beyond the gang of 5, what kind of strange ideas are there circulating in Washington?
Well, you know, a number of people have said that if you're going to get to deficit reduction, the only way we're going to do it, similar to the Ryan budget, is to go after programs affecting seniors and low and moderate income families. And they talk about it as if their ideas are the only way to go. Some of the things that they're laying on the table now, they're talking about raising the retirement age to 70 years or higher, abolishing or significantly curtailing the COLAs. Right now, I think your listeners probably are the cost of living adjustment in Social Security, which interestingly, there hasn't been a COLA for the past several years,
2 years,
because the trigger for the federal government to pay the Social Security COLA is that inflation has to hit 3% on an annual basis. Well, inflation has been lower than that in recent years. But the net effect of this is that if you don't pay the COLA for several years, at the end of several years, you've actually lost a significant amount of purchasing power. So I think some better ideas might be to examine raising the amount of wages that we tax for Social Security.
Yes.
Right now there's a cap on the amount of income that is taxable for Social Security. You could eliminate a lot of the future funding problems for Social Security if you adjusted that limit upward or even abolished it.
Yeah. So there are all kinds of issues involved here. I might note that our friends in the AARP, the American Association of Retired Persons, have sent some mixed and confusing messages about supporting Social Security changes. That's just happened in the last 72 hours or so from the time that we're taping this. We'll just note that AARP does not speak for all retirees, and that union retirees especially. We had serious disagreements with them, with AARP when the Medicare Part D prescription coverage. We thought it was too cozy with the insurance companies. So our award-winning director, Roger Carlson, and his crew are signaling me that our time is about up, or maybe it is up. But Steve Francisco, Federal Policy Director for the Minnesota Council on Nonprofits, thanks for appearing today as we look behind the Washington headlines at news impacting seniors, particularly in the area of health care, budget issues, and Social Security. And Steve, we need you back real soon as new developments unfold. And I thank our viewers today, and we look forward to seeing you on another program.